Hi, my name is Nancy Rimas, and I'm participating in the Indiana Wesleyan course NUR 334, which is the Comprehensive Health Assessment of the Well Adult. It's time for me to videotape my head-to-toe assessment of the well adult. Today, my participant is a 31-year-old male by the name of Jack Shaw. Jack will now read the disclaimer for the process.
I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Thank you very much, Jack. Now, before we get started, are you feeling well today?
Yeah.
Do you have any complaints, or
Nope.
are you sore or tired? You have any kind of problems? None whatsoever?
No problems.
That sounds great. Can you tell me your name and your birthday?
My name is Jack Shaw, and my birthday is October 24th, 1982.
Can you tell me what year this is?
2013.
And can you tell me what month we're in?
December.
Great. I've explained the assessment process to you. We're going to be looking at you. We're going to be listening to you, and we're going to be palpating or touching various parts of you to see if there's anything irregular going on. You agree to all of those things?
Yes.
Feel comfortable with that happening?
Sure.
Great. Before we get started with that process, I'd like to have you stand and walk for me a little bit.
Okay.
Stand up, Jack, and just walk over towards the wall. Great. Turn around and walk back to the bed. Now, can you do the same thing but heel to toe? Great. Have you noticed that you've had any recent issues with your balance?
No.
Any problem with your gait? You
No.
having any pain in your hips, knees, ankles, or feet?
No.
Great. Can you stand on one leg for me?
Nope.
Okay, stand on the other leg for me. Very good. You can sit down on the side of the bed now. I do want to kind of inspect the skin that's on your body. Do you have any scars? Have you ever had your appendix taken out or your gallbladder taken out?
Nope, never.
No
had
serious
any surgeries.
burns?
No.
Okay, kind of just a general childhood
Yeah.
bike wrecks and
I got a couple
falling
scars
down?
in my hands from working and things like that,
Okay.
but nothing major.
Great. That's good to know. No reoccurring rashes or itching or anything like that. Very good. It looks like all of your skin is in good shape. Let's look at the fingernails on your hands. Those appear to be intact, smooth, and natural color. No pain or tenderness there.
Yeah.
Great. Let's take a look at your head. It appears to be symmetrical. I'm going to touch your head, feeling for any kind of lumps or knots or masses or anything that might be happening there. All that seems really good. Now I'm going to just put my fingers over the temporal arteries in your head. Have you ever had a headache here?
Don't get headaches very often.
And that's good to know. I can feel them. Ouch. We've got a pulse of about 70. Does that sound natural?
Mm-hmm.
Does that sound about normal to you? Very good. Open and close your mouth for me. You had any trouble with your jaw, feeling any pain or tenderness when you open and close your mouth?
Nope.
Nope. Very, very good. Now let's take a look at your ears. I can see that they're symmetrical on your head. Have you had any pain or any discharge?
No.
No? Okay. Your antenna appears firm. Your auricle, your lobes are good. We've noted in report that you had mentioned that you do have some earwax discharge after you shower, but you didn't feel like this was.
No, my ears have always been pretty waxy, but it's not. And I've never felt like it was abnormal.
Okay, great. You don't have any problems with your hearing
Oh, no.
that you're aware of? I'm going to just try a little whisper test. I'm going to look away and say the word. Did you hear that?
Mm-hmm.
What did I say?
Nice one.
Very good. We're going to try it again on the other side. Hear that? And I said,
Baseball.
very good. Now we're going to take a look at your nose. Doesn't look like you've ever broken your nose. Pretty good for a guy your age. A lot of guys have had their noses broken. You tip your head back. Let me look up inside the nares. You did mention in your other report that you have some seasonal allergies. I've noticed today you don't seem to be having any allergy symptoms.
Yeah, today is an exceptionally allergy-free day.
Great. I'm going to occlude one side of your nose, breathe in and out. Very good. Occlude the other side, breathe in and out. I'm going to just palpate on top of your nose, feeling for your sinus cavities. Are you having any pressure in there today?
Nope.
Feeling pretty good. That's great. Now we're going to take a look at your eyes. Your eyes are both symmetrical. They seem to be in midline with your face. Have you had any difficulty with your eyes? Do you have any vision problems? Any watering of the eyes or discharge of the eyes?
Not. That would be abnormal.
Okay. Very good. So I'm going to cover one eye and test your pupil reaction with this light. Pupil does react very well to the light. Let's check the other side. Okay, very good. Now we're going to check the cardinal positions of your vision. Sorry about that. If you'll not move your head,
Sorry.
and just move your eyes and look up for me. Not your head, just your eyes. Look up.
What did you want me to do?
Not your head, just your eyes. I want to see if you can do this. Look up, look to the side, and look down.
Okay.
So we're going to look up, to the side, and look down. Very good. On the other side, look up, to the side, and look down. Now I'm just going to pull your eyes down a little bit and look at your conjunctiva, and that's nice and pink, and all that looks to be in good shape. Next, we're going to inspect your mouth. Very good. Looks like you have all of your adult teeth.
Mm-hmm.
You can see any lesions or any spots or any patchiness or anything. I've got a few cavities that have been filled back in there. Stick your tongue out for me and say, ah. You use midline. You've got your tonsils intact. You can stick your tongue back in your mouth. Do you have any trouble swallowing?
No.
No? That is great. Let's test a little bit as far as our cranial nerves go. Can you close your eyes very tightly for me? Great. Now open them real big. Okay. Close your mouth very tightly for me. Tense your jaw down. You've already stuck your tongue out. Now open your mouth for me real wide. Great. Close your mouth back up and puff out your cheeks. Wonderful. You've done a great job with that. We've inspected your hair, which is evenly spread out over the scalp. I'm not noticing any dryness or any flaking. It doesn't look like there's any type of parasitical infestation or anything. There's no male pattern baldness developing. It looks strong and healthy. You haven't had any recent hair loss or anything, have you?
No.
Great. Now I want to take a moment to look at your neck. I'm just going to go ahead and see that your neck looks symmetrical. I'm going to feel on your neck and notice that there are no lumps or masses. You're not having any tenderness on you.
No.
As long as I'm here, I'm going to go ahead and feel to see if there are any lymph nodes that are swollen or distended. You said that you're not feeling sick or ill, so there's no pain or tenderness when I touch in those places. Is there? Wonderful. I'm also going to take a moment to listen to your carotid arteries. Those are the big arteries that carry blood to your brain. We want to be sure that you're getting good blood. To the brain. And there's no swishing or anything. Can you move your head for me? Move it side to side and see how your neck works. Can you drop your chin to the chest and drop your head back? Are you having any pain or discomfort in your neck when you do that? You seem to have full range of motion. That's really great. That's real. It's going to work just fine. Let me make a few notes. Before I listen to your breath sounds, will you just breathe in for me real big? Great. Breathe out for me. Very good. And Look at your back. Do the same thing again. Everything appears to be very symmetrical. I notice that your scapulas are even, your shoulder blades are even. You've never had an accident or injury to break those areas or anything. That's very good. Can you say that you had any tenderness or difficulty with your chest or your breathing recently?
Not that it's abnormal.
Okay, you mentioned to me that you work out on a pretty regular basis, so there's been no shortness of air, no chest pain when you're doing these aerobic activities?
No, I mean, not outside of normal, high intensity aerobic exercise, shortness of breath.
Right, okay, very good. Well, we're going to start. I'm going to ask you to raise your arms up over your head. Very good, and I want to look at your chest, front to back, and compare that. Now I'm going to have you put this arm down and keep this arm over your head. I just want to palpate in that underarm area and ask you if you're having any tenderness or discomfort there.
Nope.
Good. I am going to listen to your lung sounds here. Just breathe in and out. Okay, breathe in and out. And breathe in and out. Thank you. Put that arm down and we'll try it again on the other side. So there's been no lumps, no pain or tenderness over in this area of the body.
Nope.
Very good. So breathe in and out. Okay, breathe in and out. Very good. You can put your arm down now. Now I'll listen to your lung sounds up front. Every time I move the stethoscope, just breathe in and out for me. Very good. Okay. All right, now the other side. Very good. Okay, let's breathe in and out on the back. Okay. Good. Okay, we'll do it again. And again. I'm going to have you do a little bit more breathing, but I'll give you a break right now. I notice that your posture is erect. It appears that your spinal column is intact. Just turn a little bit for me this direction on the bed. Put my hands on your back. Breathe in and out for me. Take a big deep breath in. Okay, you can let that exhale out. That just shows how well your base expands to accept your lung expansion and your breathing. Now I'm going to place the stethoscope over your lungs again, and as I move it, each time I want you to say the words 99.
99. 99. 99.
Good.
99. 99. 99. 99. 99. 99. 99.
Very good.
100.
I'm going to percuss a little bit, which is just checking for that. Looks like your rib cage is intact. You're not broken any ribs?
Nope, never broke a bone.
Kind of accidents like that. All right, you can lay down on the bed for me if you would. Very good. And now I want to do some things to check out your heart and your heart sounds. As far as you're aware, you don't have a murmur, you don't have a pacemaker, there's no history of heart disease that runs in your family.
Nope.
Very good. like to try to listen to it for a full minute? There are several places on your body where there are pulses that we can feel. Two of the most common are just right on your wrist. Real pulses. I've already felt temporal pulses. I've counted the pulses in your carotids. You can feel the radial on both sides of the body. We can also assess for pulses in kind of in the groin area. That's called the femoral artery. Sometimes there are pulses that are palpable behind the knee. That's called the popliteal area. They're usually not palpable though. And then I would ask you, do you ever experienced any swelling in your ankles or your feet that you consider to be abnormal? They don't appear swollen at all today. If we had taken your shoes off, I would be able to palpate the pulses, your pedal pulses, which are right on top of your feet. Exactly right. Let me make a few notes. Just going to listen a little bit more to your heart in the center, to your aorta. Once again, I ask you to breathe in very deeply for me and hold it. You can kind of assess where that diaphragm comes to rest. It looks like down about that 10th vertebrae and the 10th rib. Very good. You can let that out and you can breathe again. Next, we're going to take a look at your abdominal cavity. As you know, you've got not only are your guts in there, your stomach, your liver, your pancreas, your gallbladder. There's quite a few things in there. Have you been having any digestive trouble lately?
No.
Are you having any elimination problems?
High fiber diet.
Okay, great. Well, I'm going to listen to your vowel sounds in all four quadrants. I know that your umbilicus is midline and inverted, just as it should be. And we do listen for about a minute in each quadrant. So we divide the belly into fours like this. We'll start up here. Okay. Great. I'd say you're a little bit hungry. You've got some pretty good vowel sounds going on there.
Hungry.
Are you hungry? Okay, here. We're going to percuss the tone of all four quadrants now. Very good. And we're going to palpate gently. No pain or tenderness. Sometimes if you can palpate deeply, you can feel the very end of the liver, but not the liver. And the pancreas is very way outside. Oh, okay. All right. Great. Okay, I'm going to have you close your eyes right now. Can you tell me which arm I'm touching?
Right arm.
Very good. Now which arm am I touching?
Left arm.
Very good. Can you tell me what I'm touching now?
Right ankle.
Very good.
Left ankle.
Great. Can you tell me if this feels hot or cold?
Cool.
Good deal.
Cool.
Very good. I'd like you to bend your leg at the knee right here and lay it back down. Are you having any pain or trouble with your hip joints, your knee joints, your ankles, or your feet? Bend this leg at the knee and lay it back down. Very good. Take your feet for me and flex both your feet up toward your face. Great. Now push them down. Very good. Now, you don't have to raise your legs up off the bed. Just spread them. Show me you can spread them open and then bring them back together. Very good. I'm just going to palpate. Sorry. Okay. Sorry. I was just supposed to palpate those joints. I'm noticing that we don't have any edema or anything there. Sorry. Didn't mean to tickle you. I should have asked you about that before we got started. Okay, I think at this point we've completed your assessment. I appreciate very much that you participated here with me today. You seem to be an adult male who's in very good health.
I feel healthy.
Thanks again, Jack.